My dear seniors, today I want to speak to you from the heart as both a doctor and someone who truly cares about your well-being. Because there is a truth I believe you deserve to know. A truth about prescription drugs that too often is hidden behind polite smiles, long words, and tiny print on labels. You see, over the decades, modern medicine has brought us many incredible life-saving treatments, and I would never deny the value of drugs when they are truly needed. But the reality is that millions of seniors are taking medications they may not need in combinations that can quietly steal away energy, damage memory, weaken muscles, upset digestion, and even cause the very symptoms they are meant to treat. And the saddest part is that many of you are told these side effects are just part of aging, when in fact they may be the result of pill after pill slowly building up in your system. The truth is, my dear friends, the pharmaceutical system is a business, and while many doctors genuinely want to help you, the pressure to follow certain guidelines, meet quotas, and trust drug company research often means we prescribe before we explore simpler, safer solutions. I have seen seniors on 5, 10, even 15 medications, each one meant to counter a problem, and then more prescriptions added to treat the side effects of the first ones, creating a loop that quietly drains life from the golden years. What most people don't tell you is that many common conditions, mild high blood pressure, borderline cholesterol, joint stiffness, light sleep troubles, can often be improved through natural lifestyle changes, gentle movement, nourishing food, and stress reduction without a lifetime of pills, but these solutions are not promoted because they are not profitable. I've read drug trials where the benefits were exaggerated, side effects downplayed, and long-term risks left unstudied. Yet seniors are given these medicines for decades, and here's the part that hurts me the most. So many of you have come to believe that without your pills, you wouldn't survive, when in truth many of you could be healthier with fewer medications if you worked with a trusted, open-minded health provider to slowly, safely reduce or replace them. I am not telling you to throw away your prescriptions, and never do that abruptly, but I am urging you to ask questions, to keep a list of every pill you take, to research each one, and to ask your doctor, is there a natural or lifestyle way to address this? Yet when you walk into the pharmacy, remember you are not just a patient. You are a person with a right to understand what you are taking and why. Sometimes the real healing comes from fresh air, a brisk walk, a handful of leafy greens, a few minutes of deep breathing, and a good laugh with friends, not from the latest pill. I've watched seniors reclaim their energy, sharpen their memory, and even get rid of their walking frame simply by reducing unnecessary medications and replacing them with movement, hydration, and nutrient-rich meals. But this kind of recovery doesn't make headlines because it doesn't make billions for drug companies. My dear seniors, the truth about prescription drugs is not that they are evil, but that they are often overused, under-questioned, and rarely reviewed once started, which means you could be carrying a chemical burden you do not need. So please, let's break the cycle. Ask for medication reviews every year, seek second opinions, and never be afraid to discuss natural options. Remember, your body is designed to heal, and while modern medicine can be a gift in emergencies, the key to lasting health lies in nourishing and supporting your body daily, not in handing over all control to a pill bottle. Take back your role as the leader of your health team. Learn what goes into your body, and never let anyone convince you that dependency is your destiny. Because with the right care, the right questions, and the right habits, you can live your later years with more freedom, clarity, and joy than you ever imagined.